Okay, now we are going to visualize postpartum counseling. So the elements of postpartum counseling, the first element of postpartum counseling is postpartum physiologic conditions, postpartum physiologic changes. Ezekiel. Now, in postpartum physiologic changes, what happened? Here you are going to explain the woman that she is going to have discharges, Ezekiel, and those discharges are going to be changing in color from the rubra. It's going to change in color from rubra within the first 4 days to rubra is when it is very red to the next one is serosa. Serosa is the local serosa. It is within 4 to 10 days when it is going to be pink, and the local alba is when it is more is 10 to 14 days. Ezekiel. Local alba is when it is whitish. Ezekiel. Those are the physiologic changes that she has based on her local or the vaginal discharge. Now, the next physiologic change can be associated with also the breastfeeding. You are going to explain that she is going to breastfeed the child, the milk is going to come out from her breast and all that. And then the next physiologic change can be after pains, explaining how that one usually when she's going to breastfeed the child, she's going to feel pain in at the level of the abdomen or the lower abdomen. Why? Because the after pain is important because it is going to result to after pains or that uterine contraction resulting to after pains is going to, because it's going to make sure that what the uterus is going to involute. Ezekiel, there's going to be involution of the uterus by that uterine contraction causing after pains, such that the uterus is going to reduce its size. Normally, the uterus reduces its size 2 centimeters per hour in nulliparous, 2 centimeters per day. Sorry, when you're in nulliparous, it's supposed to reduce by 2 centimeters per day. In multiparous, it's going to be less fast. It's going to reduce by 1 centimeter per day. Is it clear? And in the case of cesarean section patient, it's going to reduce by 0.5 to 1 centimeter per day. Is it clear? In cesarean section patient, is it clear? Now, if there is a uterine subinvolution, it occurs in a patient that have that are in the case of postpartum endometritis. So if you have a uterine subinvolution, you think of postpartum endometritis, usually associated with a foul-smelling vaginal discharge and also fever. So those are the postpartum physiologic changes that you actually tell the patient. After the postpartum physiologic changes, you talk about the danger signs. Danger signs, and the danger signs are based on those postpartum complications that I've just explained. And I've said that there are 8 postpartum complications, and all those 8 postpartum complications are going to have particular danger signs. In case of preeclampsia, the patient is going to have headache. In case of eclampsia, the patient is going to convulse. In the case of depression, the patient is going to be more depressive. She's not going to move out. She's not going to be friendly and all that. When she has all these dangers, and in case of perineal tear, the patient has pain at the level of the perineum. In the case of after pain, the patient has too much after pains. In the case of postpartum breastfeeding complication like engorgement, meaning that the breast milk does not want to come out, it is engorged. There's mastitis. She needs to consult for all those complications. Is it clear? In the case of postpartum, when she has fever, she has to come back to the hospital. Is it clear? So those are the danger signs and the different elements that you have to speak about to her. After the danger signs, you have to speak about the nutrition. You speak about the nutrition of the mother and the child. Nutrition of the mother is that she has to take all form of diet. She has to take a complete diet. See a dietitian in order for him to explain him a complete diet that she has to take. And then for the nutrition of the baby has to feed. The baby has big meals. And the big meals, generally the feeding schedule of the baby can either be given by the baby or by the mother. The baby has to have good meals every 3 hours. Is it clear? Every 3 hours the patient should have good meals. Is it clear? So the patient should have good meals, and good and effective meals is supposed to be between 15 to 30 minutes. Is it clear? Even when the child is sleeping, he should continuously feed by method of that reflex. Is it clear? So a good meal is done every 3 hours and it's for 15 to 30 minutes. Is it clear? Why in between those 3 hours, the mother now can give now poor feeding or just like grignotage for the child just when the child is just crying, and that can be less than 15 minutes. Is it clear? So those are poor meals. Because these good meals is because what generally within the first 15 minutes what comes out is just carbohydrate and fruit. Is it clear? But after the 15 minutes now what come out now is going to be fats, is going to be protein, and the other nutrients is responsible for the growth of the child. Is it clear? So we speak about nutrition of mother and the child. The fourth element is to speak about vaccination, and the vaccination has to be the vaccination of both the mother and the child. Is it clear? If the mother has to be vaccinated for tetanus, she has to continuously take her tetanus vaccine, and the vaccination for tetanus is with a mnemonic 01611. Is it clear? 0 means that it's at first contact. She has to vaccinate 5 times. The first time is at first contact. The second time is after 1 month from the first. The third time is after 6 months. Is it clear? From the second. The fourth one is after 1 year from the third, and the fifth one is after 1 year from the fourth. Is it clear? So those are the different things. And the first one confirm no immunity. The second one confirm an immunity of the second one confer a 3-year immunity. The third one confer a 5-year immunity. The fourth one confer a 10-year immunity, and the fifth one is a life-lasting, is it clear, immunity. So those are the different things that you have to evaluate. You have to speak about in a patient that has this condition. So that's the vaccination of the mother. Now, and there are other vaccines also that the mother has to take. Now, for the vaccination of the child, you have to speak about vaccination based on the expanded program. Like in Cameroon, we have the expanded